Lung cancer is the #1 cancer killer worldwide. In fact, it kills more people than the next 3 common cancers combined. About 1 in 16 people will be diagnosed with lung cancer in their lifetime. What makes lung cancer so precarious is that a lot of the times there are no presenting symptoms, and by the time it is discovered in more than half of people, they will not be able to go to surgery because the disease is so advanced. About 10 years ago, a lung cancer screening program was studied and was approved, and the modality to go about screening is painless and very quick. It is a low-dose computerized CAT scan of the chest to determine if there are any lesions in the chest in smokers. So if you get a CAT scan, a radiologist will look at it and determine if there are any lesions or worrisome lesions. Based on that, we will all get together. We all meet once a week, what we call our multidisciplinary tumor board, and we'll look over the patient's risk factors, the patient's medical history, certain comorbidities, and we'll make a recommendation based on what we think would be the next best step. Most of the time it would include sometimes a biopsy, and nowadays the good news is there are so many minimally invasive or endoscopic options to get a biopsy, and one of them includes a bronchoscopy. We were able to place a camera down into the patient's airway, and using computer guidance and software, we're able to find that lesion and biopsy it. Based on the results of the biopsy, whether the patient has cancer or not, we'll make a determination if the patient is a good candidate for surgery, or the patient may need any additional or what we call neoadjuvant therapy, perhaps getting treatment like immunotherapy or chemotherapy prior to surgery. The majority of the lung resections that I do are robotic. They're minimally invasive, and we'll go in with the robot using a camera that has 10 times the magnification of the human eye. It also has wrist movements that allow 7 degrees of freedom, and we're able to go in and dissect out the critical vascular structures and the airway structures, and then remove the lung cancer. Doing the case robotically will certainly decrease postoperative pain, will decrease intraoperative blood loss, and will hopefully get the patient out of the hospital within a couple days. Overall, the lung cancer screening CAT scan has proven to decrease the chance of mortality in lung cancer from about 20 to 25%, which is more than, say, getting a colonoscopy for colon cancer. Obviously, the earlier the stage we get it, the better, and the better chances of long-term survival. As you can see on this CAT scan, this patient was a smoker, and there is an approximately 1.5 centimeter lesion in that right upper lobe of the patient's lung. The PET scan is another type of test in which tumors like to take up sugar. So after giving an patient an injection of radioactive sugar, cancer cells will take up the sugar and will glow. So this is, again, the PET scan, and as you can see, that area that we saw on the first CAT scan is now glowing to suggest that this is most likely a lung cancer. So I recommend that if you or a family member are actively smoking in the ages of 50 to 80, or have recently quit smoking, say in the last 15 years, that you contact your primary care physician or even anyone in the medical community, and to inquire about getting a low-dose CAT scan for your chest.